Hi, I'm Jennifer Anderson, practice manager and founder and CEO of Optimal Health Advocates, an ancillary revenue generation company for medical practices and healthcare facilities. And today, I'm going to give you a quick overview of our exclusive in-office PCR lab program that will allow your practice to capture significant outside lab revenue and have a 1-hour turnaround time on a wide variety of tests from UTI and respiratory infections to nail fungus and wound care related infections. And as a 20-year practice administrator, for me to even consider an ancillary revenue program, it had to meet 3 critical criteria: be proven in the market, have minimal operational impact or headache, and improve the doctor-patient experience and/or outcomes. Few have made this cut. I'll go over how our unique program is revolutionizing the way medical practices deliver quality patient care and increase monthly revenue by at least $30,000 per month per location, with zero out-of-pocket capital expenditure or risk for the practice. I'll show you how this program provides your practice with a complete turnkey lab operation. And lastly, I'll go over the simple steps on how to qualify your practice to take advantage of our joint venture opportunity. But first, let's go over a few basics. What is PCR testing? PCR, or polymerase chain reaction, is a molecular testing technique that's used to amplify trace amounts of DNA or RNA, essentially identifying the DNA of pathogens, like bacteria, viruses, yeast, fungi, and protozoans, which are the organisms that cause the infection in different clinical scenarios. Some of you are already familiar with PCR testing technology, as it's been available to clinicians for over 20 years, and most of your providers may already be mailing out samples to third-party labs. I can remember as far back as 1999 when the women's clinic I worked for was able to get 24-hour PCR results for chlamydia and gonorrhea. So what specialties can use PCR testing? Well, PCR testing is applicable in a variety of specialties, but our program is a great fit in specialties such as urology, OBGYN, primary care, family and internal medicine, ENT, wound care, urgent cares, podiatry, and soon we'll also be able to help GI practices. Larger surgical groups who treat post-op infections can also utilize our wound care panels. And we have well over 100 established locations across the United States. There are currently testing panels available for in-office labs for UTI and STIs, respiratory ENT infections, including over 20 pathogens from hand, foot, and mouth, and flu A and B to strep and the coronavirus. Plus, there's wound care and nail infection fungus panels. And again, in the upcoming months, we'll also be adding panels for vaginitis and GI-related infections. In this brief overview of our advanced in-office PCR lab program, I'll be referring to our UTI panel because it's a good example to illustrate the clinical benefits of PCR testing and is observed and treated in many different specialties. However, I will go into more detail at the end of the presentation on how our respiratory, wound, and nail infection panels improve outcomes when utilized in the point of care. What is groundbreaking is being able to run these tests in office, which now gives you the clinical and operational advantage of getting test results for your patients in 1 hour. Plus, it gives you antibiotic sensitivity, allowing the provider to accurately treat an infection significantly faster than a traditional culture and avoid any unnecessary treatment if no infection is identified. And because the test is identifying DNA and amplifying it, it's also significantly more accurate at identifying more and fastidious pathogens than traditional cultures usually will miss. Because traditional cultures, the quantities can be too small, or the pathogen just doesn't grow in a petri dish outside the body very well. Now, at the 2018 annual meeting for LUGPA, or Large Urology Group Practice Association, investigators reported on a study where urine samples were collected from 582 patients who were experiencing lower urinary tract symptoms and had indications of cystitis. Both a PCR test and a traditional urine culture were run in parallel. The PCR test detected 22 organisms, whereas traditional cultures only detected 15. Our PCR test results also provide an antibiotic resistance readout, which helps providers to avoid prescribing an antibiotic that the detected pathogen is resistant to. Antibiotic overuse has led to the antibiotic resistance and creation of superbugs and is a real global issue. And the treatment of UTIs just happens to be one of the primary contributors to this growing problem. Resistance in E. coli to one of the most widely used medicines for the treatment of urinary tract infections, fluoroquinolone antibiotics, is very widespread. There are countries in many parts of the world where this treatment is now ineffective in more than half of the patients. Failure of treatment by the last resort medicine for gonorrhea, third-generation cephalosporin antibiotics, has been confirmed in at least 10 first-world countries like Australia, Canada, Norway, South Africa, and the United Kingdom. According to the CDC report released last November, antibiotic-resistant bacteria and fungi cause more than 2.8 million infections and 35,000 deaths in the United States each year. In 2018, the World Health Organization identified antibiotic resistance as one of the biggest threats to global health. Now, the CDC has already started to mandate the antibiotic stewardship program, which you can see here on the slide, in hospitals and long-term care facilities. But it will only be a matter of time before it's mandated in the outpatient clinical setting as well. Now, we've created a program here that helps you keep you compliant and proactive with the antibiotic stewardship program, since we can provide you with reports showing how your use of PCR testing reduces the use of antibiotics and will increase your facility score. Improving treatment at the point of care will have a huge impact, since annually UTIs cause 10 million office visits, 23,000 deaths, and cost $13 billion. Now, there's a growing wealth of studies, too many to cover all today, that show how the use of PCR testing technology in many different specialties is improving the patient outcome and helping providers to prescribe antibiotics more appropriately. But the other great thing is that it's also reducing the overall cost of healthcare. In a 2017 study, traditional culture missed identifying infection up to 30% of women. Now I'm going to share a little story here with you. Back in 1998, I just so happened to be one of the statistics in patients that was prescribed a standard protocol of Bactrim DS antibiotic after presenting with symptoms of a urinary tract infection, and later ended up with me being in the ER with severe back pain and nausea, and I was eventually admitted for a kidney infection and treated with IV antibiotics. Now, my symptoms came on very fast and unfortunately in the evening. Now, this is going back 20 years ago. But the initial treatment treatment protocol for UTIs hasn't changed significantly. At most practices, you still have to wait 2 to 5 days to get results back to confirm the pathogen and the accurate treatment for your urinary tract infection. Had I been able to get a PCR test that first visit, the provider would have known which pathogens they were dealing with and seen the resistance markers in the report and been able to prescribe the appropriate treatment the first time. And would have been great to help me avoid hours of intense pain and the expense of an ER visit admission. Now, that Thursday night, instead of being doubled over, throwing up in the ER bathroom, I would have been at home with my college roommates, watching the next episode of Friends. But on a more serious note, I was young and healthy and able to return home early that next morning. But what if it was your mother or your grandmother who may be immunocompromised or at higher risk for sepsis? The situation could have been life-threatening. In her lecture on urinalysis history and case studies, Dawn Tobin stated that the number one cause of sepsis is from UTIs. And in PhD Rachel Burnside's discussion of early sepsis indicators, she indicated that sepsis is the third leading cause of death, 80% of cases due to bacteria. Results of a large population-based study published by the Imperial College of London suggest that delaying or withholding antibiotics in elderly patients with a urinary tract infection increases the risk of sepsis and death. The risk of bloodstream infection was more than 7 times greater in patients who did not receive antibiotics immediately after seeing the general practitioner for a UTI. Death rates and hospital admissions were also significantly higher for those patients. Point-of-care PCR testing is one of the ways that we can decrease and avoid these life-threatening and costly cases of sepsis. By integrating our in-office PCR program into your practice, you're going to get same-day results that will allow you for more accurate and timely treatment, eliminate the overprescription of antibiotics in your practice, and improve patient satisfaction and outcomes, and reduce the overall healthcare cost. Now, with one testing unit running 8 tests per day, you can generate over $30,000 per month in bottom line revenue with our program. So let's take a closer look at how the financial side of the joint venture works. Now again, the complete turnkey system is designed to be effortless on your part. Our team gets your practice completely set up with a testing device, dedicated on-site technician, CLIA licensed, that includes the molecular testing, high complexity CLIA certificate that will cover molecular testing, and we handle the setup and certification of your lab and maintain compliance. Plus, we also handle the pre-authorization and billing process. And one of the unique benefits to this program is that the on-site technician is trained to do the pre-authorization in-house prior to any testing. So you can rest assured that there are no insurance or coverage surprises for the patient or the practice, and almost zero denials. So let's take a look at this pro forma example. Now, this example is for a practice that runs the minimum of 8 tests a day, which is about $175 a month. Now, while there is no upfront cost to get started, there is a cost per test of $265 to run the lab, which is invoiced to the practice only after insurance has reimbursed for the service. So from a cash flow perspective, this program works really well. Now, after expenses for running the lab are covered, you can see there's a 50-50 split of revenue, and the practice monthly revenue is a little over $30,000. And one of the questions I have been asked about our program is how we handle the higher cost of PCR testing, since it is more than a traditional urine culture. Now, even with the clinical advantages, this can be an area of concern. However, in our program, the contractual relationship that the practice has with the billing company allows the practice to maintain complete control, and we establish policies and procedures ahead of time that will set cash pay pricing that's appropriate for your patient population and determine how your practice will handle patients with high deductible plans and also any collection activities. And all that's required is a 6-foot-long workspace, ideally in a 10 by 12 area. Again, CLIA licensure and ongoing lab management and compliance is part of the program and does not require any upfront costs. So how do you know if your practice or organization is qualified to participate in this program? Well, there are 2 things that we look at to ensure the venture is going to be profitable for both parties: sufficient test volume and average reimbursement. For volume, program participation requires an estimated minimum of average of 8 tests per day per location. You can get a ballpark figure by looking at how many cultures you're sending out each workday, or if you're already using PCR testing, how many of those are you mailing out daily? If you have multiple locations in an area, but not enough volume in any one location, we can often meet minimum volume by using a courier to bring patient samples to a single lab location. To confirm this estimate, we're going to take a look at the last 12 months of historical data for a specific set of ICD-10 codes, which we'll provide to you, that are specific to PCR testing. Now, this report is easily generated from an EHR or practice management software in just a few minutes. Then, if you meet the minimum test volume of 8 tests per workday, our billing and credentialing team will work with you to evaluate your insurance payer mix and determine what your average reimbursement rate for PCR testing is. Once we confirm that both volume and average reimbursement are advantageous for both parties, you will receive a letter of approval and a customized practice pro forma showing you how much income is going to go to your bottom line each month from this program. Now, at this point, you and your decision makers will be allowed to speak with one of our clients that's already benefiting from the program before moving forward with onboarding. Once you give us a thumbs up, we can have your lab up and running tests in about 30 days. Okay, so that's the general overview. And to get started, You just want to get in touch with your account executive, and they'll answer any further questions you have and help you complete your practice pre-qualification. And after you've been approved, in 30 days, you'll have dramatically improved patient care, satisfaction, and outcomes, and have a new revenue stream of at least $30,000 per location going to your bottom line each month, all with zero risk or capital investment. So if you don't have an account executive yet, you can reach out to us on our website, or you can reach us by email at admin@optimalhealthadvocates.com, or just call us at 877-733-4887, and we'll help get you going. And now if you want to keep watching, you want to learn more about the respiratory, wound, and nail infection panels, go ahead and do that. Otherwise, thanks for watching today, and we look forward to working with you soon. Okay, so next I'm going to be going into more detail on how our other available PCR testing panels for respiratory, ENT, wound care, and nail infection work in the point of care setting. Okay, so we're going to start out by taking a look at our respiratory testing panel. So implementing our PCR respiratory testing at the point of care allows your providers to give an accurate targeted antibiotic or viral treatment at the initial patient visit, which will improve your patient outcomes and satisfaction and reduce the overall economic burden of respiratory infections. Now, our respiratory panel, as you can see here on the slide, identifies over 30 bacterium, viruses, and fungus. And each year in the United States, as you can see on the slide, that over 31.4 million outpatient visits result from flu, 200,000 hospitalizations, 300,000 to as many as 49,000 deaths. So more than $87 billion in total economic burden. So really a huge, huge deal. Now, observational studies suggest that a rapid turnaround time for respiratory virus testing, particularly for influenza, is a cost-effective strategy. The CDC recommends that patients who present with a syndrome consistent with influenza and also have a negative antigen test should also have a confirmatory PCR test. Now, the determination of whether a patient requires a respiratory virus testing involves, of course, clinical interpretation that considers the presenting signs and symptoms and the day of illness at presentation and other risk factors such as extremes of age or immunocompromise. Now, in observational emergency departments and outpatient clinics, the clinical utility and effectiveness of these rapid respiratory virus testings have been studied in several different studies. And what we found is that patients in these settings have been shown to receive fewer antibiotics, undergo fewer diagnostic tests, be more likely to receive effective antiviral therapy, and be less likely to be hospitalized. And these outcomes have been demonstrated in both pediatric and adult patient populations. Now, our advanced in-office solution for PCR testing provides a swift and accurate diagnosis, really reducing overall healthcare costs through the appropriate use of antiviral and antibiotic therapy options that work the first time, reducing the spread of these respiratory infections and disease, and the overuse of antibiotics or additional testing like chest x-rays. Plus, it reduces the hospitalization time or even the chance that they will be hospitalized, and also decreases any isolation or quarantine periods. So next we're going to discuss the PCR wound panel and how it's helping providers in the wound care space to personalize care of wound patients and dramatically improve their healing success rate. So in the United States, 6.5 million people suffer from these chronic wounds, and the total cost of chronic wounds is kind of difficult to measure, but has been estimated to be over $39 billion a year. But even more importantly, of course, is the patient impact, resulting in like loss of limb or eventually loss of life, is really just for too many patients. And the major chronic wounds, diabetic foot ulcers, venous leg ulcers, pressure sores, non-healing surgical wounds, are all increasing at alarming rates due to sedentary lifestyle, obesity, and most importantly, double-digit increases in diabetes each year. Now, studies have shown that this is because chronic wounds that fail to progress through normal wound healing trajectory, are a large and growing problem for an already burdened healthcare system, and many wounds are difficult to heal because of the large, complex community of microbes present within the wound. So, it becomes even more important here that accurate identification of these complex multi-drug resistant organisms will help providers to treat and eradicate limb-threatening ulcers and associated infections. It'll ultimately lead to longer and more active lives for patients while eliminating the perpetuated resistance developed by these organisms. Now, our wound panels identify a variety of pathogens associated with wound infections. You can see down here at the bottom of the slide. And a study we'll take a look at next here, which compared clinical cultures with molecular diagnostics, found that 168 wound samples were evaluated, and PCR technology identified 338 unique pathogens, where a culture only revealed 17. Cultures just failed to grow the vast majority of the microorganisms present in the wound. So the important generalization that we can take away from this study is that the culture methods are really not adequate for identifying bacteria in a polymicrobial infection. PCR testing provides a quantitative representation of all the microorganisms contributing to these polymicrobial infections and is not affected by the patient's concurrent use of antibiotics. Another study looked at the clinical culture versus DNA identification for 51 chronic wounds. Now, molecular methods identified 17.7 pathogens per sample, whereas the clinical cultures grew only 1.8 pathogens per sample. Now, the major finding here was that up to 59% of the aerobic bacterial load was not identified by culture, mostly because it's difficult to grow. Now, with the emergence of point-of-care PCR wound pathogen testing that are specific to and developed to address the pathogens found in wounds, wound care can move away from this trial and error approach to treating these wounds to a standard medical model of accurate, same-day diagnosis followed by accurate, targeted treatment. So next we're going to take a look at implementing a nail infection PCR lab panel into your practice and how it can improve your ability to accurately and quickly diagnose nail infections caused by bacteria or fungi pathogens. And we'll also talk a little bit about how the evidence that's now present to pay for this particular type of testing in a podiatry practice. So you can see the list of detectable pathogens here on the bottom of the slide. And one of the most common infections that we see is onychomycosis, and which accounts again for more than 50% of all the pathologies worldwide sent out. So now onychomycosis is a fungal infection of the nail plate or nail bed. It does not usually cure itself, and it can trigger more infectious lesions in other parts of the body. So it's important to address this. Now, the reported prevalence of onychomycosis is increasing in the U.S., presumably due to the lifestyle changes or the aging of the population. Now, it's a progressive infection of the nail characterized by a thickening of with degrees of white to yellow-brown discoloration and separation of the nail from the nail bed. Now, here's why molecular testing is really medically necessary for proper diagnosis and quality care. So PCR testing improves the patient outcome. The conventional laboratory diagnosis of onychomycosis up to this point routinely involves only direct microscopic examination and of the clinical specimen to determine the presence of fungi. Now, however, this does not identify the specific genus, species, or specific pathogen, nor does it differentiate between yeast and molds. And tests often report a high rate of false negatives, resulting in inappropriate care or no treatment at all because of the negative result. So, The clinical features of onychomycosis are also challenging and can be confused and mimic other nail pathologies such as psoriasis, eczema, dermatitis, lichen planus, and malignant melanoma. So it is critical that the practitioner must have this information and identify the cause of the nail disorder in order to create a proper treatment plan. So what this is telling us is that our conventional diagnostic techniques have kind of fallen short in terms of specificity and sensitivity and time to diagnosis. Further identification of fungi grown in culture takes several weeks, with a failure to isolate the pathogen in 30 to 50% of the cultures. So PCR testing done at the point of care will give you results in an hour and with antibiotic sensitivity as well, and improves the sensitivity of actually detecting the causative fungi in nail specimens from patients with suspected onychomycosis. And because it amplifies specific DNA sequences of the dermaphyte fungus and at the point of care lab, it's notably the fastest method that's available and will lead to a significant reduction in time used to establish this diagnosis and initiate a treatment. So, the reasons we need a more sensitive and targeted method for laboratory testing are that the prevalence of nail fungal problems is a worldwide problem. There is a potential for communal infection and cross-infection, and problems associated with self-diagnosis and misdiagnosis are very concerning. And there are adverse effects and potential toxicity for the long-term use of antifungal drugs. So, with more specificity regarding the infected organism, PCR testing can differentiate into species, strain, and subtype, and help physicians tailor the fastest and best treatment for improved patient outcomes and the elimination of more costly trial and error approach to treatment that's currently in practice. So that wraps up our presentation today. And remember, our team is currently working on adding additional testing panels for vaginitis and gastrointestinal panels this year. And so your account executive will be in touch with you if that's appropriate for you. And again, if you have additional questions or are just looking how to get started, get in touch with your account executive and they'll help you complete your practice pre-qualification. And after you're approved, in 30 days, you'll have dramatically improved patient care, satisfaction, and outcomes, and have a new revenue stream of at least $30,000 per location going to your bottom line each month, and all with zero risk or capital output. So if you don't have an account executive yet, you can reach out to us via our website or email here on the screen, admin@optimalhealthadvocates.com, or just give us a call and we'll help you get going. I thank you again for watching today. Again, this is Jennifer Anderson, founder and CEO of Optimal Health Advocates, and we do look forward to working with you soon.